Good afternoon, everyone, and welcome to our webinar in celebration of National Recovery Month. Before I introduce the two amazing women that we have on the panel today, I'd just like to take a minute to introduce myself and tell you a little bit about the Lawyers Assistance Program. My name is Eleen Travis, and I'm the Executive Director of the New York City Bar's Lawyer Assistance Program. We are a free and completely confidential program for lawyers, judges, law students, staff, and family members who are struggling with either a mental health issue, a substance abuse issue, or really any issue, either a personal issue or professional issue that's interfering with their ability to function. We provide assessment, we provide supportive counseling, both on an individual basis and on a group basis. We have a very unique service called peer support. So when individuals call us and they're at the very beginning of their confrontation with either a mental health or substance use problem, we have a wonderful network of volunteer attorneys, judges, and law students who are in recovery. They've been through similar kinds of situations, and they very generously give it their time to mentor your colleagues. It's a completely confidential relationship. Anything that you talk about with a peer support person is completely protected. And then we also have some really tremendous referrals available, treatment professionals, treatment programs, if that should become necessary. So as I said, September is National Recovery Month, and we thought it would be a perfect time to talk about the impact that substance use disorders have not only on the individual, but also on the family members. And we don't often speak a lot about the impact on family members. So we thought that that was a very important thing to do today. We do know some things. We know that the incidence of substance use in the legal profession is 4 times higher compared to the general population and also to other professionals. And we don't have any specific data yet on the incidence of substance use during the pandemic. We do know from the CDC that the prevalence of symptoms of anxiety disorders is 3 times higher, and the symptoms of depression is 4 times higher than it was in the last quarter of 2019. And that was just of June, this past June 2020. We also know that alcohol sales have increased by 55% since April, and that the levels of stress, anxiety, fear, and uncertainty that are associated with COVID-19 can lead to self-medicating with alcohol and drugs in order to cope. They certainly can exacerbate a pre-existing condition. So someone who was drinking but sort of managing their drinking or drug use and are now dealing with all these extra intense emotions, that can certainly progress a problem. And it can also be a trigger for relapse for people who are already in recovery. For every one person who is dependent on alcohol and substances, at least 5 other people in their immediate circle are affected by their drug and or alcohol use. And certainly that's family. Family comes first, and then it can extend to colleagues at work and other kinds of relationships with friends, the community at large, and certainly the medical community is affected. At Lawyers Assistance, we often get phone calls from spouses of individuals who are struggling with an alcohol or drug problem. We get calls from parents who are living in other states and have their kids attending law school in New York that are concerned about their alcohol or drug problems. We get calls from adult children who have parents who are struggling, and they're all really looking for help in how to encourage the person who is using the substances to get help. And as happens sometimes, the person who is having the problem is unwilling to go. So in that case, we work with the family. Today, we are very fortunate to have Lisa Smith and Elene Zimmerman with us today to talk about how substance abuse has affected them on an individual basis and also as a family member. Lisa is a former practicing lawyer and law firm executive, as well as a recovery coach, speaker, and podcast host. She works with legal employers and other organizations to break the stigma around substance use and mental health disorders and to promote employee well-being. Lisa is the author of a wonderful book, Girl Walks Out of a Bar, her acclaimed memoir of high-functioning addiction and recovery in the world of New York City corporate law. And I'm happy to say that Lisa is a friend of Laura's Assistants. We've done many presentations together, and it's great to be back together doing this one. And Eleen is a new friend, and I hope a long-term one. Elene Zimmerman is a journalist and social worker. For 3 decades, she has written about business, technology, and social issues for a wide array of national magazines and newspapers. She was a columnist for the New York Times Sunday Business section for 6 years, and since 2004 has been a regular contributor to the newspaper. This month, she completed a master's degree in social work. Welcome to the profession. And she is the author of a wonderful book called Smack, a story of white-collar ambition, addiction, and tragedy. So Eleen, let's start off with you. For those people listening in who have not yet had an opportunity to read your book or didn't see the article in the New York Times, could you explain what happened with Peter?
Sure. So the book grew out of a story I did in the New York Times in 2017 about my ex-husband, Peter. We'd been divorced 5 years, but married 20, and had 2 kids together. And he was a mid-level partner at Wilson Sonsini in San Diego, which the firm is based in Silicon Valley, but he was at the San Diego office. He's very successful, very intelligent, had 2 advanced degrees. He'd been a chemist before becoming an IP attorney. But in up 2 years, he died in 2015, and 2 years before he died, he started behaving erratically, losing weight. He looked terrible. He was constantly sick and sleeping. He was having problems at work. He was being chastised for those problems. It accelerated and accelerated until one weekend he was really, really sick. Our kids had been there. They left very distraught. And 2 days later, I went up to his house to take him to the hospital, ostensibly, and found that he had died. I thought he died from working too hard, being a partner in big law, and that may have been part of it, but he died from complications of intravenous drug abuse. And that's where my memoir, Smack, begins, where I start unraveling the story of what happened to him and how he developed this secret life of drug abuse and addiction that led to his death, and also led to a host of problems for myself and my children, the colleagues and people he worked with, and the community. And so the book is about his story and what happened to him, what happened to our family, and then there's some reporting about lawyers specifically, and in a bigger sense, white-collar drug use and abuse.
So how do you think he was able to hide his addiction for such a long time?
I think he was able to hide it because we were also complicit in that hiding. I think his colleagues, the senior partners he worked for, myself, his children, his friends, all believed that someone like him wouldn't possibly develop a drug addiction, especially an intravenous one. And so his behavior, which was very erratic, and physically, he had all the signs of somebody who was struggling with an opioid addiction or an amphetamine addiction. But to all of us, we imagined it was anything but. Maybe it was bipolar disorder. Maybe it was an eating disorder. Maybe he had cancer. Nobody wanted to ask him about that. A parent I knew suggested maybe he had AIDS. All of these things which were quite far-fetched, as opposed to addiction, which was not so far-fetched and right in front of us. So I think that helped. And I also think Peter, like a lot of other, quote unquote, high-functioning folks that abuse drugs and alcohol, was very smart and clever and persuasive, and convinced me certainly that it was exhaustion, a health issue, not being able to sleep, that he smoked, that he had a thyroid condition, all those kinds of things. And I knew the profession to be a very stressful one, that he was very depressed and anxious anyway, and those symptoms kind of fit. He didn't sleep well because he was always worried and always beholden to the clients and that kind of thing. And he was very clever about hiding it. He was using it at work because we found lots of parts of needles in his work bag, but he must have found ways to use in his office. He had a private office. I think he worked from home a lot. He was not showing up more and more. He was at home. And he had a network of dealers that lived in the suburbs and were a lot like him, professionals with families. And so they accommodated each other's schedules. And so that combination, I think, allowed him to do this for a long time.
Okay. I'm glad you mentioned stress and anxiety because we know that mental health and substance abuse problems go hand in hand. Excuse me, statistically, they say that 60% of individuals with substance use problems have underlying mental health problems. I think it's a lot more. I
And,
think it's
and it's important to note that lawyers, when surveyed over the course of their careers, the depression among them is 40%. So that's a lot of depressed lawyers.
certainly is. So did you notice at this time any behavior changes, how he responded to you, how he responded to the children?
Yes, and I noticed them and his colleagues noticed them too. So for me, it was that he would forget to pick our son up from school. By that point, my daughter was at college. In the book, I have a chapter where we dropped her off at school in Michigan and he just left and said he had an emergency at work, which I now realize was not an emergency at work. It was that he could not find drugs in Ann Arbor and he was starting to have withdrawal symptoms. So his behavior became really erratic. He had been so responsible and he was this, high powered attorney with all these associates under him and support staff. And he had always been very devoted to work. And now he was like not showing up for meetings, or his boss told me after he died that they'd be on a conference call together and Peter would start talking about an unrelated topic like online shopping or something. And his boss would be like, all right, well, let's get back to this issue, and didn't really understand what was going on. He'd leave long messages as voicemails, or he'd have these meandering texts in all caps that didn't answer a simple question that you'd asked. He'd be late to everything. He'd stop showing up at all kinds of school activities. He would forget about doctor appointments. And he was sick and sleeping so much that it didn't make sense. So there was definitely very clear signs. He also had physical signs like hair loss, dramatic weight loss. He had sores on his hands and face, which are a side effect of methamphetamine use. Things I didn't understand at the time, but now seem very clear.
Lisa, does this resonate with you? How were you with your family and friends and colleagues when you found yourself progressing into addiction?
Yeah, absolutely, it does. My story was that I was a first-year associate at a big law firm, and that was when I became a nightly drinker. I'd always been kind of a big partier, and I knew that in my family there was this genetic predisposition towards alcohol abuse, and what I didn't know at the time was that, as you mentioned earlier, which is so important, especially for lawyers, is I had an underlying undiagnosed mental health disorder, depression, major depressive disorder I was diagnosed with, and anxiety. And I had been self-medicating, for years before I ever got into practice, but then it really took off when I had that crazy, stressful schedule. For me, it was a 12-year downward spiral, with the last 18 months being when I really had to drink around the clock. I couldn't get out of bed without drinking. And I added, instead of deciding I'm going to stop drinking, I was like, maybe I'll just add some cocaine so I can, balance myself out. That's what I did. And for 18 months until I was fortunate that I called the fight and said one day, decided to check myself into detox when I couldn't do it anymore. But it's very much the same. I think what you talked about, the way there is this, it's easy to sort of be under the radar. I feel like it's a little bit easier because people expect lawyers are going to be stressed out and they're going to behave like stressed out people. I think Eleen gave great examples of how Peter would isolate himself. He left Ann Arbor all of a sudden. I would have plans to go to see my family in New Jersey for the weekend, and I'd realize I'm not getting there. And so I would say I have to work. And if you're in the legal profession, no one questions. At that point, I was out of law school for, 12 years. They'd heard me say cancel plans because I had to work as a junior associate a million times. I was able to work from home almost, very much. And I could calibrate when I had to go into the office, but that wasn't unusual. I would send work product in the middle of the night, but so did so many other people. It didn't stick out. I think if I had started I was on the staff side. I switched out of practicing after 5 years. And so I wasn't really the one in charge. Peter was in a very in charge position there. But if I had been presenting work product that wasn't cutting it to people who were in charge, there might have been a harder look at why that was. But as it was, and it was the same with my friends and family, they didn't catch it because they were thinking, yeah, she drinks too much. A lot of people drink too much. And they didn't see me, I could go out to dinner with my friends and we'd have drinks at dinner, and they'd go home and put their baby to bed, and they didn't see me pull out a bottle of wine when I got home and drink it by myself. And, the isolating, that's why this whole situation now with the pandemic is so dangerous for so many people who are forced into isolation. But so that, there's a lot, I think, in common with that there was stuff that they just couldn't see because, I held them at bay. I held work at bay, and I held my friends and my family. And, there's that question about like, well, why didn't you just tell them you were in all this, in all this pain and having all this struggle? And, I know we're going to talk about it a little bit more, but it's a scary position to be in. Like, nobody wakes up in the morning and says, you know what, I've got this 8:30 meeting, so I think it would be a great idea to have a couple of drinks, and then I'm going to have a couple lines of Coke, and then I'll go to that meeting with the partners. That's what I was doing at the end. But, it certainly wasn't like I was getting away with something, or that somebody said to me shortly after I got sober, well, the party had to end sometime. And I was like, I don't know what party you were at. I wasn't there. It's miserable.
So what I heard you both talking about, which is such an important part of having addiction or living with an addiction, is the isolation. It is such an isolating problem. Mental health problems as well is so isolating, and especially for lawyers, the stigma, which we'll talk a lot more about, which still remains the number one reason why attorneys as a group are reluctant to reach out, because of fear of job loss, fear of confidentiality, other people finding out, how they're going to be looked on, how it's going to affect their reputation. So they're even more isolated than people in general who are isolated from these problems, and try so hard and work so hard to hide those problems. And in a sense, the family members also become isolated because they don't necessarily understand, as you were talking about, Eleen, exactly what's going on. And very often, as a family member, we don't want, there are certain things we really don't want to see. We may not want to believe that this person that we love and care about is struggling with a problem that we may not know nothing about or don't know how to handle. So it can be isolating on both sides. Eleen, how do you think your children were affected psychologically and emotionally in dealing with Peter?
I would say overall, there was so much guilt and shame. So when he first died, I was at his house, and I called my children, wanted to come up, and I didn't tell them until they got there that their dad had passed away. And my son took complete responsibility, thinking he should have gotten his father to the hospital. We all thought, oh, maybe he died of a heart attack from working too hard, And my daughter was just so angry. And then once we learned what it was, there was just an enormous amount of guilt and shame. My daughter said she was very ashamed that this would have happened to our family. She always revered her father and thought he was so brilliant and so capable and competent. And I will say there is something about lawyers, for those of us that are not attorneys, we look to them for the answers. And here was a man who was not only an attorney, but a scientist. So it was like, he just knew everything, so it was hard to imagine that he would take this kind of risk with his life, his kids were down the hall and he was shooting up, like just unfathomable. So I think what happened to them was it was a process of trying to understand what their culpability was in it. But I will say that I think for the rest of their lives, especially my son, who was with his father that whole year and a half, his sister had gone to college 6 months into it. He took enormous responsibility. He told me when he was 16, he said, I think there's always going to be a part of me that will feel guilty or responsible for Dad's death, thinking even though it's not true, there's a part of him that thinks if I'd just gotten him to the hospital, even though none of this was his choosing. And my daughter had to really, they both had to really work hard not feeling ashamed that this happened to our family, you know, instead of understanding that this was happening in lots of families like ours. It's just that nobody's talking about it, which was one of the reasons why I wrote the book and the story for the Times. But so I think for them, it will be lifelong. And of course, they lost their father. And so, you know, no one can take that place. And I, even though we were divorced, we were good or bad, very codependent co-parents. And, you know, I lost the one person in the world that loves my children as much as I do. And there are many times where I could use his logic and his advice from when he was not sick. And I'll never have that either. So I think it's a great loss. And there's a lot of survivor's guilt too in the family. Even though we didn't choose to use and go down that path, I get to, you know, so far, I would see my kids growing into who they are going to be, and he doesn't. And every time that happens, I think, I can't believe he's not here to see this, you know, and they feel it too.
Yeah. In your book, you write about being gaslighted by Peter
Yes.
when he was trying to hide his addiction. And you write about how intensely distressed you are by that. Could you talk a little bit about that?
Yes, I was thinking when Lisa was talking about the isolation, you do feel really isolated. I remember asking some of my girlfriends very close to when Peter had died, I said, am I crazy? Am I crazy to be worried about this? Or because I couldn't, like, he would just say things. For instance, this isn't in the book, but he was supposed to go to Paris with our kids on vacation, and it was 4 weeks before they were supposed to leave, and he didn't have flights. And I kept saying, you have to get the flight so I know what's going to happen. And I was very worried he would sleep through meeting them at the airport. They were going to come from New York, where I was going to visit my family. And I was so stressed about it. And he kept texting and saying, you're such a nag. Like, why are you always so overly cautious? And that's when I would say to my friends, is this normal? Am I being crazy? You know, like things like that. Or when he had to leave Ann Arbor, he said, there's an emergency at work and only I can handle it. And I said, it's Labor Day weekend. You're the only partner in the entire office of 150 people that can handle this. And when he said, yes, it's my client, like Lisa said, I thought, okay, you know, because his clients had taken precedence over so much in our lives that it felt like not a weird thing. You know, it was only later I realized that wasn't it at all. So that kind of being gaslit and thinking you're crazy took an enormous toll. My hair was falling out. I couldn't sleep. I was losing weight, and I was already thin. And I just remember going to have my hair colored, and this was 2 days before Peter died, and they were combing my hair and a giant wad of it came out. And the colorist, who was my friend, she said, no, that sometimes that happens. So, and I knew everybody thought like, oh my God. And I thought, this is really making me sick, you know? So I think it has a real physical impact on the members of your family.
Lisa, what was it like for you to hide your addiction from your colleagues at work and your family and your friends?
It was miserable. It was really, it's almost like there's this parallel spiral, like going down physically through addiction, through going from drinking at night. Now I drink at lunch. Oh, well, that's not great, but I don't drink at breakfast. Okay, now I drink at breakfast. That's terrible, but I'm going to get control of it. You know, I was constantly telling myself, I can get control of this thing. And then next to that spiral, in my like sort of saying, just wait a minute, I'll make this better. I'll fix this, you know, is all because the lies start to add up. And I'm realizing that I'm not showing up for things. I missed my niece's birth. I, you know, was constantly, you know, making plans and then not going through with them and lying. And the shame and the fear is really hard to describe. And by the end, by the time I got to the bottom of both those spirals, from all of that, what it takes away from the person going down is really their self-esteem. You know, I thought so little of myself, nothing of myself when I was at the bottom. I used to get up in the morning and thinking about what I knew I had to do all day just to get through the day, and what a bad person I felt like that made me. And I would just look in the mirror on my way out the door and say, I hate you, you know? So that's sort of what that felt like. and I didn't feel, like there were those two things. I felt very much constrained in that I have the stigma issue, but we'll talk a little bit more about that. But also, there is this constant feeling, and I hear it over and over, of people saying, I know this is bad. Like, I remember saying to myself, I know it's bad that I drink at lunch, and then in the morning, I know it's bad I drink in the morning, but I'm going to get this under control. And why wouldn't I think that? As lawyers, we have succeeded. We've done things that, we set out to do, and that was it. And if you looked at life on the outside, just like Peter, it had all those trappings, good job, nice apartment, nice family, friends, like wasn't, but, it's that idea. And I think Eleen hits on that idea also of that high functioning. I always say that high functioning alcohol and substance use disorder, it's a myth, because you are high functioning until the day you are not, right? You are high functioning until the day you get a DUI on the way home from work, or the day that you sleep through that meeting, or you miss a court date. And you see, like, all those things were, it's incredibly tragic that Peter died the way from this. But, at some point, the bottom was going to fall out. You don't remain you don't see high functioning people in their 90s with drugs and alcohol.
It's so true.
Yeah.
Yeah. So what you're describing is what happens with most people with addiction problems is some type of external motivator happens. It's either, fear of loss of a job, fear of loss of family, or the job saying either you get help or you're gone, or the family saying you get help or you're gone. There are very few people who wake up in the morning and say, gee, I think I'll change my life today. With addiction, it just doesn't happen because of all the psychological processes that go on in the brain. Why do you think you were reluctant to reach out for help at that time?
Well, again, it was the piece that thought I could do it myself. It was the stigma, as you and I have spoken about many times, Eleen, is that, as we know from the 2016 ABA Hazel and Betty Ford study of lawyers who struggle with these issues, that the number one and number two causes, like not even close, for people who responded that they were struggling with a substance use disorder, why they didn't reach out for help, were one, fear of my colleagues finding out and judging, and two, fear that these resources that you tell me are confidential, like the lawyer's assistance program, like the employee assistance programs, you tell me they're confidential, but I don't trust it. My information is going to get out, and then we're back to number one, and people are going to find out. For me, I felt very afraid that, the day that I decided to go to detox, like you say, like something happens. The thing that happened to me was it was a Monday morning, and I was on my way to the elevator to go downstairs to go to work. I was a director of client development at a big firm at the time. And for some reason, I had to drink and use cocaine to calibrate myself at that point. And I became overcome with this feeling that I thought either like, oh my God, I've overdosed, or I'm having a heart attack. I felt in that moment, like whatever, I now know it was a panic attack, but whatever was happening, I thought, I'm about to die right here in this hallway of my building on East 20th Street. And something snapped and said, I don't want to do that. And I got to stop. I can't do this anymore. And that's when I went in and asked for help. But, before that, there was also the fear that I felt of, if I can't get this under control, if I do have to do something, what does life look like on the other side? I had no sober references. I didn't know anyone who was in recovery, or it was 16 years ago, but still, there was no one in my family. There were no friends. I was terrified of what it would look like to ask for help, in addition to all of the stigma stuff. Mm-hmm. And I feared that with work, I would have left the office the Friday before that Monday morning, being considered a capable, reliable, trustworthy member of the team. I was doing well. I had gotten a nice raise and bonus the month before. and that I would come back if I had to go away and take a leave for rehab or something like that. I would come back and people might not know why I was gone, but you know, it'd always be a little suspicious, or maybe they'd surmise, and then I'd be viewed as somehow weak or defective or maybe amoral, whatever it was. And that was just very scary.
I'm glad you mentioned the 2016 report that was done by the ABA and Hazelton Betty Ford that really substantiated the numbers, you know, the percentages of alcoholism and substance abuse, depression, anxiety, stress in the legal profession. I mean, I've been doing this for 20 years, and 20 years ago, we couldn't have this discussion. We could not, we basically, we had to do a dog and pony show and somehow slip it in, you know, talk about ethics or some other issue. So it's really wonderful all these years later, and largely due to the report, that the word is out, that these discussions are, you know, becoming more open, and that hopefully lawyers will get help sooner rather than later. Families will be protected, clients will be protected, and the profession will be protected. So, Eleen, even though you didn't realize what was happening when, you know, Peter was using opioids and amphetamines, and you were trying to co-parent, as you said, you remained friends, and you had this opportunity to co-parent your children. How do you think it affected Peter's ability to parent his kids?
Oh, I think, you know, he definitely was a loving father, but he had a lot of trouble being a present father because of the profession's demands. So, you know, even now my daughter has a boyfriend, and he was talking about his father and some stuff they did when they were younger. And she said to me, I can't remember that many things Dad did with us, just because he was always working. So I think when he became really addicted and in the throes of it, probably the last 13 to 15 months of his life, he just kind of slipped out of their lives. So I didn't have a co-parent. I felt like I was completely on my own, just trying to reach him to ask a question like, let's say my son at the time was going to have to use a topical antibiotic. I can remember this for like acne. And I texted him and I said, what do you think of this? You know, is this okay? I don't think we should do the oral thing. I kept texting and texting. I called, and then he would like get frustrated at me for nagging him. And I said, well, did you read the text? And he'd just be like, well, what text? You know, like he couldn't focus on anything. It was like, I remember thinking, maybe he has ADHD and it's been undiagnosed, and now it's really coming to the surface. Because he had problems with the organization. His longtime secretary had threatened to leave several times. And she told me after he died, we had all of these, we kept having new systems and new systems. And she said, but at the end of his life, she didn't realize like no system would work because he couldn't keep track of things. So my son was in a band in high school, and they would play it in Del Mar, California. They have a big fair each year. He played at it. And the last 2 years, like this is how it would go. I would wake up in the morning and I would send Peter an email saying, don't forget, it's 12:30 today. You know, this is the stage they're at. I would send him a copy of the map and the parking. I'd be on my way there. I'd text him like, Peter, are you up? Are you up? Are you coming? We'd get there. And then I'd be calling and calling. And the first year, so he had just started probably using, he showed up the last 5 minutes of the performance, and I was so aggravated. And then the last year he texted me and he said, oh my gosh, I fell asleep and I've been sleeping. I can't believe I missed it. And my poor son, you know, he's 14, 15. He's just like stopped expecting it. So I became the only parent, even though there really was another parent. And I started to become hugely frustrated because I really wanted the other parent, but I couldn't count on him for anything. Not even for the nights he was supposed to, you know, we were divorced. So every other weekend, the kids would be up there, my son, after my daughter left for college, and once a week. And I got to the point, I do have this in the book, where Peter was so late to pick up our son from high school, who had cross country practice. So he didn't even need to be picked up till like 5:30, that he would often be a couple of hours late. And my son would walk up to like a Mexican restaurant near school and just have dinner and wait in the dark for, you know, he'd be outside. And then finally Peter would call and say, just go up and have dinner. And he was humiliated in front of his friends, who's, you know, nobody's parent was forgetting them for hours. This was a private school, you know, Peter had wanted them to go to. So I just said to Peter, I'm going to pick him up on your night and you can pick him up at my house. And so what happened was it enabled Peter to just say like, could you just stay at mom's tonight? I'll see you on the weekend. And after he died, I had his bank statements and I had his texts and phone records, and I could match up on those nights. I was kind of giving him permission to just use all night, to go out and get drugs, to party, to like, you know, because now he didn't have a son even that one night a week. So in hindsight, a lot of things became clear, but I can tell you parenting was a nightmare.
Okay. Were there other things that became clear after Peter died and you got to know the full extent of his drug addiction?
Yeah, one thing that became very clear was that he definitely felt he could not go to anybody at the firm for help. I saw some of his texts with some of the people he was buying drugs from and some friends that he used with that I don't know, I don't know them. But one person he was texting with was about trying to quit. And he had in his drawers when he died, like these all natural kind of withdrawal ease, it's called, to try to help you through withdrawal. And I think he was calling it like his math test. And I think somebody that had used and had gotten sober was kind of trying to advise him. And he was like, I'm going to do the math test next week. And I think he just thought, I'm going to just tell my firm I'm sick with the flu for a week and I'm just going to get through, it's going to be over. Not realizing how ill he was at the time with this infection related to intravenous drug use, and just his entire dopaminergic system had been hijacked by this enormous use. So he had these like ideas that he would just be alone and get better. And what happened was, when he was alone is when he started binge using, and that's what eventually led to his death, either a combination of overdosing and being sick, or the sickness just completely causing his organs to shut down. But I realized that he was just trying to do so much on his own. He would write down he had a little journal he kept, and one of the things he wrote was that he was increasingly feeling less comfortable around his kids, probably because he was less comfortable generally, and that he really wanted to quit. But I don't think he felt at all comfortable telling anyone. I know that when we were married, he was feeling really stressed and depressed, and I suggested he call the EAP and ask for a referral to a therapist, and he laughed. He was like, I am not going to call an 800 number and tell them I'm depressed. Like, it was like, you know what? I'm not doing that. So instead he bought a martini shaker, and that started, you know, and I was like, I don't really drink martini. I guess that's what we're going to be doing now. So that kind of thing. So I think what Lisa mentioned is right. I don't think he felt like it was legitimately viable for him to ask anybody. At one point when he was very unhappy, I suggested he see a business coach to figure out maybe a way to leave the law. And he was even afraid that if he did that, somebody somewhere would find out and it would get back to the firm. So hard to imagine the systems that are in place to help lawyers are things they're going to take advantage of.
Lisa, having worked in a big firm and now working with a lot of firms to help them with their well-being, do you find that that's still true of a lot of attorneys and firms, that they are very reluctant to go into the in-house EAP to get help for their problems?
You know, it's interesting. I think it is shifting. And in part because, you know, certainly when I was, 16 years ago, first of all, it never occurred to me that I was self-medicating depression or anxiety. That's why I was doing this. We didn't talk in a law firm, certainly, about depression or something like that. And certainly not substance use. You know, it was something where the profession is so soaked in alcohol that, really in a law firm, it's kind of, the culture can be very much that, fun equals alcohol. Like, you must have alcohol at any event or that's not a fun time. It's how we celebrate filing a brief or closing a deal or entertain clients or recruit, like any number of things. But so there is that, but I think since 2016 and since the study came out and since the American Bar Association really formed its task force on attorney well-being and has been getting out in front of firms and of the profession and saying this has to change. And in 2017, that task force issued a report called the Path to Lawyer Wellbeing that gave ways for every stakeholder, from law schools to firms to academia, judges, on how to improve the situation. And then in 2018 issued the challenge to all legal employers to take a pledge to advance employee well-being all along. And one of the things that's been very popular, and raising awareness about this, and firms undertaking to present programming to normalize this conversation, to rethink how alcohol is used, to de-emphasize alcohol in all events. And it's not saying, no one's saying get alcohol out of law firms. It's just simply not the case. It's just like, let's be more thoughtful about it, because it was so the opposite. But the biggest thing that I've seen driving it really is sort of the generational change, where in my, when I was a junior associate in the early 1990s, I would have never talked about these things. We have, now in the profession, it is the younger people coming up, and they've grown up talking about, they know what anxiety is. They talk about depression. Many of them have been treated for it or are currently being treated for these things. So they're fluent in it, and they expect it from their employer now. They expect that a law firm is going to be willing to talk to them about these things that are not at all, off limits. And I think that has been the greatest shift. And what that has done is, I feel like, embolden more people to, when I was a junior associate, if a partner came by at the end of the day, or 8 o'clock at night, and said, hey, we're all going to go to the bar, you want to go? I would be like, yeah, great, I'll go. I love to drink, and this is a good bonding experience, and this is how, I get to know people at the firm. And other people who maybe wouldn't have wanted to go felt compelled to go, because you don't want to miss out. Yeah. But now you have people who are the younger lawyers are just as much inclined to say, no, thanks, I have plans tonight, or, they're realizing. I spoke at a firm a little while ago that it was the summer before last, and they said, it's interesting, we had to rethink our whole summer associate program, because we have 8 summer associates in this office, and 4 of them don't drink. We found out, religious reasons, they're training for a race, they just don't, when we found in just these little tweaks and trying to change things at the but when I was the deputy executive director of the last firm I was at, we had an event where it was a big celebration of 100 years. It was at Rockefeller Center. And, we had at the entry, when people walked in, we had our, typical signature cocktail here, have a pomegranate margarita. But we also had, not just at the bar, but actually on offer right there, a virgin mojito. And it was astounding how many people went for the mojitos, and not just that, but also said to us, even like clients, saying, I'm so glad you did this, because I'm getting on the train tonight to go do math homework with my kid. I really didn't want to drink, but I was stopping by to celebrate with you guys. We assume that everyone thinks fun equals alcohol, and we're just learning more and more that that's not the case. And it goes hand in hand with these issues of understanding that, yeah, if I'm stressed out, I want to talk about it. I want to be able to, not, why should I start feeling shame in a law firm when I haven't felt shame growing up in my life with this? So I that's what I see being the biggest driver of the change.
So I agree with you. What you're talking about really is a cultural shift in the legal profession towards not using or having alcohol as so much a part of being a lawyer, and certainly making these changes. And
just considering it, and taking it from the vantage point that, not everyone drinks and not everyone wants to drink all the time.
Exactly. And also, so many of the firms in the city embracing this whole idea of wellness and well-being, hiring in-house people, having a lot of webinars. I actually did an orientation for summer associates at one of the firms. And what they did was they had a panel, and they had the in-house, the doctor that is the medical director of their in-house insurance and runs their EAP. She was on the panel, and I was on the panel. So she was talking about internal resources, and I was talking about external resources. We were all talking about the same thing. So I thought that was a really great way to, present that there is all this help available. Be that as it may, stigma is still alive and well. I mean, we speak in all the law schools, and I'm still amazed at how many calls we get, law students saying, you know, I'm seeing somebody from depression. Is it going to prevent me from being admitted to practice? And even though we bring people from the character and fitness committee that tell them, no, it's not going to prevent you from being admitted. As a matter of fact, it's going to make you a better lawyer if you have a problem and you take care of it in law school. There's still this reluctance. So we still have a lot of work to do, but I think, you know, it is very promising. It is, you know, it has been really great. So Lisa, what was it that finally, you started talking about it a little bit before, but what happened that finally led you to reach out for help?
Well, I think that morning when I had my panic attack that I thought was a heart attack or an overdose, I had known for so long, and you know, you don't really have it at the forefront of your mind when you're in it. But I had known, you know, I can't go on like this forever. I mean, but then there's a sort of, you become kind of resigned to it. Like, this is what I am. This is who I am. You know, I mean, it sounds like a silly thing, but like when I was, you know, in my mid 30s and I was, you know, getting very, you know, circling the drain, I stopped contributing in my 401k at work because I was like, why would I put money away? I'm going to be dead by 40. You know, like, why would I put money away for when I'm 65? And I became resigned to that. And for whatever reason, I think at some point being resigned to that started to give way to, you know, maybe I'll take one shot at trying to fix this. And I think it was also it was just staring me in the face that all of my telling myself that I was going to get it under control, that I could do this, that, you know, because I really had believed that it just wasn't going to happen. But I didn't, you know, that morning that I sort of snapped and decided to go ask for help, I really didn't know what that meant at all. All I knew was in that moment, I thought I was going to die, and I knew I needed to go to the hospital. And I knew I needed to, you know, to have, because I had, of course, been researching this stuff, that I would have to, as physically addicted as I was also very physically sick. And, you know, it was around the clock for so long that I knew I'd need to go have a medicated detox. I knew I couldn't detox safely because when you're really at that kind of point, you can have a heart attack, your blood pressure spikes. There's, you know, it's dangerous to detox on. So I knew I'd have to go to the hospital, but I didn't have any idea what that meant for after. I didn't have a plan of like, okay, now I'm going to go to the hospital and I'm going to stop drinking and I'm going to get sober and I'm going to do all this. It was just like, wait, no, I don't want to die today. What do I have to do? And then, you know, once I got the clarity, once I had 5 days of detoxing and got everything out and finally had my, you know, my brain back in, certainly not entirely, but in a place where I could actually clearly think without a substance coursing through my veins and go, wait a minute, what do I want to do here? And that was when I decided I was really going to give it a try. And it just kept getting better and better. And I kind of started looking back, the physical feeling better, you know, was the thing that started. And then the mental feeling better came along after.
And how did your family and friends and colleagues react when you finally started telling them about what was going on with you?
Well, I didn't tell my colleagues. And part of that, big part of that, was my fear of stigma. You know, the same reason why I didn't tell them when I was struggling, I wasn't going to tell them. I was in the detox for 5 days and I talked to a psychiatrist every day while I was in there. And at the end, they expected me to now go off to an inpatient for a month of rehab. You know, detox just gets the substances out of your body. Rehab is where you learn how to, you know, get sober. And I was like, no, I'm not going. No, I told because I knew if I had, I knew I could be absent. It was a Monday morning and I knew I could be out sick for 5 days, but if I was going to, without a reason, but I'd have to produce a note from some doctor, some sort of doctor, if I was going to be out a 6th day. So I knew going in, as soon as I made the decision, it's interesting because I was close to my friends and family as much as I kept them at bay. But as soon as I made the decision, I'm going to check into the hospital for 5 days today, I didn't call them right away. I picked up my laptop, I opened it up, and I emailed the partners that I worked with and the administrative people that I worked with and said, listen, I had a medical emergency over the weekend. Please don't worry about me. I'm totally fine, but I'm going to be in the hospital this week again. So I'll be out of touch, but not to worry. I'll see you next week. And so when they said to me in the detox, now you got to go away for a month, I was like, I'm absolutely not doing that. I'm going back to work. And that's what I did. And I don't recommend that. I mean, I have been incredibly fortunate that I have not relapsed, but relapse is a part of so many people's stories. And the more time you can get in rehab on the front end to load yourself, the better. So I mean, part of why I tell my story is I want someone else to make a different choice when that happens. And so I didn't tell them at work. And I did tell my family and friends, who were ranged from, oh, that's good, to shocked, to denial. Like, you're not, you don't drink so much that you got to be hospitalized or any of that. But it was, I think they started to put pieces together in hindsight. But mostly the most overwhelming thing I got from them was, oh my gosh, I wish I had known. We would have helped you. We could have helped you. We could have supported you. We wouldn't have judged you. We wouldn't have. But what that misses, I think, in both with work too, with the fear of stigma, but it's also a fear of like, hey, wait a minute. I don't know what I'm doing here yet. I just, I was, doing a ton of cocaine and drinking drinking wine by the bottle like yesterday. I don't know what's going to happen. So when they be like, I'm so much glad you're better, I'm like, I don't know if I'm better, So you're afraid of, is this really, what if this doesn't stick? Now I've told all these people. That also kept me from sharing with people at work a lot because, then all of a sudden it's like, hey, she went to rehab and now she's at the bar.
Right.
So, yeah, but the reaction, and then when I finally did talk, I stayed at the firm I was at for 10 months and I loved all the firms I was at. I was so fortunate to work with great people all along the way. This was about me. This was not about the firms I was at. And I left the firm that I was at the time, 10 months into recovery. I still didn't say anything to them. Because, like I said about the high functioning thing being a myth, it's like I realized that I was functioning well at a job about here, but that when I was sober and actually present and showing up, I could take a job about here. So I ended up leaving after 10 months and going to another firm. I didn't tell them when I joined the firm. I'd been sober 10 months. Your story is your own. No, you don't owe anybody your story. And, I was fortunate that it wasn't a circumstance where I had no choice, where it was found out for me. But then I would write. So I was at that firm and I started writing in the morning, and then it was 10 years until I got my book deal. And I had shared with some of the people that I'd become close to at the firm over the years. So I worked with the partners and, a number of them knew the people that were my friends, but it wasn't like common knowledge. And I had just become a member of the firm's management committee and become the deputy executive director when I got my book deal. So I really had to start with the management committee, and then everybody knew I wrote, but nobody really pressed on what it was. Like if they did, I'd say it's a memoir. It's about a struggle I had, and hopefully I'm on the other side. And then people leave you alone. So I said to people, hey, I don't know, my book's going to be published. And that's great. I heard, we're so excited for you. I would be in the doorway of a partner's office, and then I would walk in, I'd shut the door and be like, now let me tell you what it's about. And, I have to say, first of all, I got zero, sort of aghast or, negative responses. The most common response I got by far was that, I'd feel like I had to fill the air. So I'm like, I was really high functioning. I never got arrested. And I would get interrupted. They would interrupt and say, you know what? My cousin, my law school roommate, my friend from high school, my brother, my sister, whoever. And it was like, everybody knew somebody. And it wasn't just that they knew somebody, but they had questions. You know, it was like when I told them I got the book deal, I remember this in September. And so I was talking to people late September, early October about this stuff. And I got questions like, you know, my brother-in-law is coming for Thanksgiving and I know he stopped drinking. Like, what do we do? Do we not serve? Like, what's the right thing? How do I talk to somebody? And that's when I realized, and this was in 2015, before the book came out in June of 2016, that's when I realized, I was like, we're ready to talk about this. There's no question, because we're already talking about it. We're just doing it behind closed doors and we don't really know who to ask. So.
Thank you. Eleen, it's been 5 years now since Peter. So what are some of the deeper and longer term issues that you and your children are dealing with or have dealt with since then?
I think we've done really well, and I think it's because people are generally very resilient. I think the longer term issues will be questions around their own substance use. You know, my daughter was at a really big party school. She was at University of Michigan. There's a ton of drinking and psychedelic use and all kinds of party drugs. And, you know, we had a lot of discussions. She would go to electronic music festivals and everybody's tripping and like using Molly and all kinds of different drugs. And, you know, we talked about what it can do to the brain and what it means to have a parent that was had an addiction, and that you're 10 times more likely to have an addiction yourself. So like my son barely drinks, and I would say my daughter has really, you know, after college, she kind of just regrouped and is a very careful social drinker, you know. So I think in that way it affected them. Maybe it was sort of a good cautionary tale for them that they will be. I think I think it might also have an impact on them if they become parents. You know, my son's they're only 22 and 24, but my daughter, you know, feels certain she wants to be a mother someday. And I think she'll especially be aware of being present for her kids. I will say she had wanted to be an attorney, and that changed. And I think part of it was that she said, I want to be able to see my kids. And, you know, I hope, like what Lisa said, I do think law is changing. And I do think the youngest generations of lawyers are the ones that are forcing the change. So that's a good thing. So I think that is a lasting, that'll have a lasting impact in a positive way. I think, you know, but I also think there'll always be this really kind of deep sadness for all of us that, that all of these milestones in their lives will not be witnessed by the other parent. You know, I can't be two parents. I felt like I was trying to be when Peter was very sick, and that doesn't work. You know, you can't fill that hole. And so that's just something they'll have to live with. I will say, if I could just, this isn't so much about the impact on me, but when you talk about this time, the pandemic, I did do a story that's coming out in October in The Guardian about drug use and drinking during COVID. And I did interview some lawyers, and I will say, the one theme I saw among the few that I interviewed was the isolation. Was working from the basement office or something makes it either easier or harder, in this case easier, to drink and to use and to do it so much that you develop, maybe you were using recreationally or maybe you were a bit abusive in it, but now it tips over into something entirely different. So I do think that's definitely something to be aware of now. Yeah.
Absolutely. So could you both talk about how your experiences have shaped your life and your goals for the future?
You want me to go first? Okay.
Sure.
Okay. Well, I think my experience of certainly finding somebody that I knew so well dead had a profound experience, had a profound impact on my life. And for me, I think the process of cleaning out Peter's house and selling his things was a real education in consumption and overconsumption and all the different addictions we have to buying things and to food and to alcohol and drugs and people and sex and everything. Made me, and also all of those things he had, a beautiful house full of things, did not fulfill him in some fundamental way, because he was obviously still looking for either medicating or looking for some fulfillment he couldn't find for many reasons. I think for underlying mental health issues, and he was adopted, his past personally. So it made me think about my own life and also about the preciousness of it, I think, and the fact that I was in my 50s and, you know, wasn't going to last forever. As Lisa said, she was told the party's going to have to end at some point. So I decided to go back to school for a master's in social work, which I just finished. And figure out a way to kind of pivot in my own life to continue writing, but about different issues, not so much business, but maybe about, I recently had a piece in the Times about trauma and resilience. So more about being human and about addiction, about sobriety, about, you know, trauma and social justice and everything else. And then also do some good in the world, hopefully, as a social worker. So for me, it had that effect on me. And so that was, I think, a good thing.
Wonderful.
For me, yeah, it changed my life pretty completely being, I mean, in a sort of outward sense, having gone through this process, I spent the last 15 years of my career in law firms as an administrator that was, you know, fully present, fully engaged, and, you know, really got reward out of what I was doing. And now, since the book came out and I started doing this other stuff, I realized this is really what I love, and I'm actually present and able to pursue what I'm doing. And so now I do, you know, I work with clients and I work with firms full time, which is, so it's a total change in life. But the biggest change is that, you know, from the time I was a kid, I was sort of this gloomy kid. I was never comfortable in my own skin. I, you know, really had terrible imposter syndrome, and I was always sad, and I was self-medicating. I never felt good enough and whatever. And now what happens in recovery is you can, you can stop, or I stopped looking in the mirror and saying, I hate you. And I start looking in the mirror and saying, you're just another human here trying to do the best you can today. And that's good enough. You know, I mean, it is a weight off. You know, I used to carry this big boulder, and now, you know I'm not going to control what happens next, but I can just, you know, I can just show up each day. And if I do that and I don't pick up a drink, it's pretty good, whatever comes along.
That's wonderful. So we do have some time for questions. So I'm going to ask if anybody out there has any questions to put them in the Q&A box. And let's see, I see one question coming up. Kevin, for some reason, I can't access the Q&A. It's not opening. Kevin, are you there?
Yeah, I'm here.
Okay.
Well, I have one question here. It says from an anonymous attendee. Can we shift to a culture of law firm and how that impacts attorneys to, Can we shift to the culture of a law firm and how that impacts attorneys and may discourage them from disclosing such problems to their employers?
Ladies, do you want to take that?
I could speak to that just because I've done a lot of research for my book on law firms. And I think that there's the biggest thing at play is that if you disclose to your employer or you tell a colleague that you're struggling, the fear is that it's a weakness and it's a vulnerability. And I think in the profession that may be shifting, but there is a desire to not show weakness and to really portray yourself as somebody who's always at the top of their game and is up for anything and is gonna, you know, there's so much competition within, especially in big law, within a firm. So in Peter's case, he had colleagues that he worked with for a long time that should have been friends, and they were friendly, but they were also competing for matters for the same clients. So for instance, there was a guy that he worked with that was married but didn't have children and could go to a lot of medical device conferences and pick up clients that way. Peter had 2 children and a wife and other responsibilities, and cross-country meets were on the weekends. And if he wanted to attend those, he couldn't really travel. And so he felt really conflicted and angry about that. So we would go to events and he would be friendly toward this person, and behind this person's back would be furious. And I think that culture, you know, so certainly he was never going to confide in that person like, God, I've been feeling really stressed out or down, because that's not going to happen. So I think, and also I remember thinking that if he had told his boss, who was the managing partner of the firm in San Diego, who showed up at his house when he died saying a neighbor called him, and then I think he was aware that Peter was struggling with something. But I think if Peter had felt that he could close the door and say to this guy, like, I have a problem and I need some help, I do think he would have gotten help, and I think his job would have been saved. But I think in his heart, Peter believed that would never happen. I mean, here was a partner who was impaired running cases. So, you know, that opens up what about the firm's liability? What about malpractice? And I think lawyers do think about that. It's a litigious world and it's a litigious profession. And So I think all those things conspire to make it really difficult to admit this vulnerability and weakness, and not just substance use, but also what if you're struggling with stress or depression or anxiety. And I will actually tell you, American Lawyer, ALM Media, I think they're called now, they did a survey of lawyers just before the pandemic. And even in that 2019 survey, it showed that depression and anxiety were up. So despite the lawyer well-being pledge, despite the fact that we're having conversations like this now, lawyers are still feeling anxious and depressed. And certainly since COVID, with furloughs and pay cuts and clients losing client business because the clients are losing business, I can't imagine that it's created a culture that's more open to admitting those things.
Yeah, I would just add to that. I think you're exactly right. And also one of the things, and this has gotten worse in the pandemic also, is that there is this culture of, you know, it was always expressed to me as work hard, play hard, right? Go out and be, you know, entertaining clients or out with your colleagues until 2 a.m. and then be bright-eyed and bushy-tailed behind your desk at 9 the next morning, ready to go for another really long day. And now with the pandemic, especially now that but this was happening before, as Eleen said, because now everybody is so tethered to their devices 24/7 that not only are you expected to be available, but you're expected to be available on top of your game, ready to respond, you know, when things happen. So there is, you know, I don't know, and it's not just lawyers, but certainly for lawyers, I don't know lawyers who go to sleep more than arm's length away from their device, unless they've made a conscious effort to put the phone in another room at night. So that is like another layer on the culture, I think, that is, again, it's something that, you know, we're talking about more and we're trying to address, but at the end of the day, that is a real battle, because it is, you know, there are things that can be done. And I mean, we talk to people like partners and senior lawyers about saying, you know, hey, if you don't need to contact that associate on Saturday, if it can wait till Monday morning, I know you want to get it off your list, but maybe wait till Monday morning because they'll take it like something they have to respond to right away. But at the same time, it is always going to be that client service profession where the client's going to call and somebody's going to jump, and, you know, it just gets that much more exacerbated. So trying to figure out how to carve time has to become more of a priority, because at least for me, when I was practicing, I might be in the office until midnight, but when I went home, unless you were going to call me on my landline at 3 a.m, which certainly happened enough, but, you know, I was off the clock until I got back to my computer the next day, because we weren't walking around with work in our hand all day. So I think that's another factor.
Yes, surveys have actually showed that the top two, I think they are the top 2 reasons why lawyers feel dissatisfied with the profession or unhappy or stressed out and depressed is the 24/7 culture, and the fact that the clients have so much power over them. Mm-hmm. And the other thing is billable hours, which is also creates this intensely stressful culture where you're billing every 6 minutes. Yeah. So that's a really good point.
So this is a question for you, Lisa. When did you realize during the time of your drug abuse that you were suffering from an addiction?
Fairly early on in my drinking. I remember I started drinking nightly as a first-year associate. And I remember by the time I was a third-year associate, I would, you know, like my parents growing up, they always had cocktail hour. My dad would get home, they'd have, you know, it'd be a little bit festive. They have a drink, they download about their day, and then they were done. And so I started making excuses fairly early on. Like I would say when I got home at 11 o'clock at night, well, you know, I wasn't home for happy hour, so I'm just having happy hour now. And that happened to be like standing in front of my refrigerator in my underwear, slamming 2 beers. Like that's not exactly happy hour. So, but you tell yourself that. And I had started going to different liquor stores on the way home every night so that no one person would think I bought a bottle of wine every night. Mm-hmm. And then it got to when there was a real, I was getting worried, and I said, I'm just going to say, one morning I woke up and I drank more than I planned to again. And I was, you know, beating myself up again. And I said, all right, if I have to go to the liquor store tonight and buy a bottle of wine. I'm not drinking today, but if I do end up drinking today, then I know I'm an alcoholic. And I remember standing in the liquor store that night, picking out a bottle of wine and saying, okay, I'm an alcoholic, but I'm really more of a heavy drinker. And if I am an alcoholic, I'm a high functioning alcoholic. And a lot of people are high functioning alcoholics. You know, you drink if you had my job too.
Yes.
You know, that sort of thing. So I really knew it was, you know, it was, if not entirely out of my control, was largely out of my control at that point. But I was past the point where I could wake up in the morning and say, I'm not going to drink today. I couldn't do that anymore.
Mm-hmm.
Or I couldn't know that I would, or I'd set out to have 2 and I'd end up having 10, you know, that kind of thing. So it was early on, but again, it's always all those other things start piling on, and you find every justification to say, well, look at that person. That person's worse than me.
Yes.
You know, you can always find that person until you are that person at the end of it. But, yeah, I mean, it's typically, I remember one time questioning when I was in the detox, saying to the doctor, well, I don't know, maybe I'm not. And I was like, people don't end up here typically just, you know, without a problem.
Okay, so this is a question that we get a lot. But before I see the time is approaching, that we're going to have to end. If anybody has any questions, I will make sure that everybody that signed in gets our contact information so that you can ask us any questions that you want directly. So this question is, if someone you care about shows warning signs of using, how can you approach them and offer them help without making them feel defensive?
You want me to take that?
Go ahead, you take it and I'll chime in.
Okay. So, you know, I was always very paranoid, certainly when I was going into work under the influence, that people would find out. And I think, but I also, you know, everything was going along just fine. So in my mind, I had this picture taken care of. If someone had come up to me and said, you know, Lisa, we noticed like you're not here a lot and we kind of smell alcohol, you know, have you been drinking? I would have like, nope, not me. I don't know who you are. I've never, you know, I would have made some ridiculous excuse about having been at a lunch where I tasted somebody else's wine, you know, because like it just comes like that. And I would have redoubled my efforts and not dealt with that person again. If somebody, I'm sorry, that was my phone. If somebody had said to me, Lisa, is everything okay? You don't seem yourself. We haven't seen you around as much. Everything okay? I most likely would have said, oh yeah, I'm fine. Nothing to worry about. Yeah, no, I've just been really busy. And so I've tried to work at home because it's a little easier sometimes. And then but it would have registered in my mind that this picture that I thought was, you know, all together was maybe not so all together. And it would have planted a seed. People are seeing something. People are I'm not, you know, what I think I'm putting out there. And if I'm not what I think I'm putting out there, what really is going on here? So that's sort of what I would suggest. You know, maybe somebody you haven't had, who you used to have coffee with a lot, and now with the pandemic, you don't, and you just haven't been in touch. You know, maybe and if something seems off, just check in on them. But there's also a really strong argument to just check in on your healthiest friend too at this time. So I'll turn that back to Eleen.
So Eleen, did you want to say something first?
I was going to say, one of the things that I learned through the research is that, especially in a firm, like what I wish would have happened with Peter was that someone who was close to him had pulled him into a private room and said, I get the feeling that you're struggling with something. I don't know what it is, but I just want you to know I care about you and I'm here when you're ready. Right, because people, if you're not ready to change, you're not going to change. But that's because I think if it had gotten worse for him and he knew there was someone at the firm that was not going to sell him out and that was going to help him, he might have felt like, all right, you know what, let me take you up on that because I'm in trouble. So.
Thank you. You took the words right out of my mouth. No, that's perfect. You know, the things to keep in mind is when you speak to someone, you have to do it in a non-judgmental way.
Exactly.
The second thing to keep in mind is that it's not your job to diagnose a person. So if you say something like, I think you're drinking too much, you've lost that person completely. The defensiveness will immediately come up and the conversation will end. So basically what both Lisa and Eleen said is just to check in with them and say, you know, I'm concerned because you look tired. Share your observations, you know, and what you do, what's happening when you're doing that is that you're starting to chip away at the stigma. Because if you've noticed that something's going on, chances are other people have noticed too. And somewhere, even on an unconscious level, that, you know, it gets in there, you've planted a seed. So even if the person is not ready at that particular moment, hopefully sooner rather than later, they'll come back to you and say, you know what, I need help. Or, you know what, this is what's going on with me. So anything you can do, and I really do, you know, when we speak at firms, we say you're a family. And now we're all a family because we're all going through this pandemic together. It's really important, not only for self-care, but that we all take care of each other. And it is important to reach out to people that we know are not in good shape and people that are usually in good shape. You know, all of our friends, all of our colleagues.
I would add, oh, sorry, go ahead.
Go ahead.
I was just going to add one thing to that too, is that when you say that, understand that you're, you know, manage your expectation of what's going to happen. Don't expect that if you say something, then that person's going to be, you know, immediately say, oh my gosh, I'm so glad you asked, or go and get help or do anything. And if nothing happens out of that conversation, just know that you have done what you could, and that there is, you know, at the end of the day, it's going to have to be the person saying, I'm done, I'm ready to go.
Okay. So I just want to let the audience know, because I see that our time is up, that we have a tremendous amount of resources between the three of us. There's a tremendous amount of support available, not only in New York. There is a lawyer's assistance program in every state. There is 6 in Canada and 1 in the UK. So we're not just talking about a local problem or even a national problem. We're talking about an international phenomenon that affects the legal profession really all over the world. And all over the world, there are recovering attorneys, judges, and law students and family members who have been through the struggle, who generously give of their time, as Lisa and Eleen did today, to really help other people. And that's really how this all works. It's really reaching out and offering to help people that are struggling. So I really want to thank Lisa and Eleen for so much of yourself. Thank you so much. And thank you for all the people that attended. And again, I will make sure that you have our contact information. So thanks, have a great day, be safe.
Thank you.
Thanks, everybody.
Bye-bye.